Have you noticed that many people start with only a minor problem, but eventually end up with multiple chronic diseases? Hypertension, diabetes, and heart disease begin to appear one after another. You may think you are treating the problem, but in reality, you may only be addressing the surface. The real key is not how many diseases there are, but whether the underlying core mechanism has been identified. When the root cause is not resolved, diseases continue to emerge. Starting with hypertension, it may seem like only a matter of stress or aging. Then blood sugar becomes uncontrolled and develops into diabetes, which can further affect heart function and eventually even lead to kidney failure. This is not the progression of a single disease, but a gradually worsening pathway. When we only treat each symptom individually while ignoring the shared underlying cause, diseases begin to appear one after another. When you solve one problem only to find another one appearing right after it, that is exactly the phenomenon of treat one, lose another. It is like picking up rice dumplings one by one. When you pick up one, another falls away.
You control the blood pressure, but then blood sugar problems appear.
You improve the heart, but the kidneys are affected. This does not mean the treatment is ineffective, but rather that only the surface problem is being addressed while the shared underlying mechanism is ignored. When the core issue is not resolved, problems continue to shift and accumulate. In the modern healthcare system, each doctor usually focuses on one issue within their own specialty. Cardiologists treat the heart, nephrologists treat the kidneys, and endocrinologists treat blood sugar. This division of labor makes treatment more specialized, but it may also overlook the overall connections. When diseases actually arise from the same underlying system, treating only one individual problem often cannot prevent other problems from continuing to appear. The real key is not how many problems you solve, but whether you find the core, being the string of a bundle of rice dumplings. Once you lift the main string, the whole bundle comes up together. When we focus only on surface symptoms, problems tend to recur again and again. But once the underlying core mechanism is identified, many diseases that appear to be different may improve at the same time. The direction of medicine should shift from fragmented treatment toward understanding the whole system and its root cause. Treat the one core, and many diseases may improve together. The human body is a highly integrated system, not merely a collection of separate organs. When one key system develops a problem, it affects not just a single organ, but triggers a chain reaction throughout the body's overall function. What you see are different diseases appearing, but in essence, they may simply be different manifestations of the same system in different locations. When the body begins to develop problems, it often does not show up at first as a serious disease, but instead as subtle changes that serve as warning signs. Fatigue, cold hands and feet, and even declining sexual function may all be early signs of systemic imbalance.
These seemingly minor signals are actually reminding you that a problem has already begun.
You may think you are facing many different diseases at the same time, but in reality, those problems may simply be different manifestations of the same underlying cause.
When we focus only on individual symptoms, it becomes easy to overlook the true core issue.
Only when you begin to search for and understand the underlying cause, vascular blockage, can you break free from the cycle of repeatedly recurring diseases.